Assalamualaikum and hi! In this video, I am gonna talk about my topic, the introduction, the main topic, and also the conclusion. The topic that I choose is Tourette syndrome. Tourette has been linked to different parts of the brain, including an area called basal ganglia, which helps to control the body movements. When there is some differences detected there, nerve cells and chemicals that carry out the messages between them may be affected. The trouble in this brain network may play a role in Tourette syndrome. Tourette syndrome is a condition of the nervous system. It causes people to have tics. What are tics? Tics are sudden twitches, movements, or sounds that people do repeatedly. For example, blinking their eyes over and over or make a grunting sound unwillingly. Having tics is a little bit like having hiccups. Even though you might not want to hiccup, your body does it anyway. Sometimes people can stop themselves from doing tics for a while, but it is so hard. There are two types of tics, which are known as motor tics and vocal tics. Motor tics are movement of the body, meanwhile vocal tics are sounds that a person makes with his or her voice. The main symptoms of Tourette syndrome are tics. It usually begins when a child is 5 to 10 years old. For motor tics, the examples are blinking eyes, shrugging the shoulders, or jerking an arm. Meanwhile, for vocal tics, the examples are humming, clearing throat, or yelling out a word or phrase. Tics can also be either simple or complex tics. For simple tics, it involves just a few parts of the body, for example, squinting the eyes or sniffing. For complex tics, it involves several different parts of the body and can have a pattern, for example, bobbing the head while jerking an arm and then jumping. There is no cure for Tourette syndrome, but there are treatments available to manage the tics. For people with Tourette syndrome who have tics and do not get in the way of their daily life, they do not need any treatment. However, medication and behavioral treatments are available if tics can cause pain, interfere with school, work, social life, or cause stress. In conclusion, people need to be more aware about this syndrome. For some places, they may not be exposed with this kind of syndrome, but there is no wrong for learning and knowing about this, right? Besides, if we are more exposed to many kinds of syndromes, we will be more aware about them when the time comes. People are also need to spread more awareness about this and treat people who have this syndrome or any kind of syndromes with kindness. Remember to always treat people with kindness. Thank you and bye!